Hello again. This is Dr. Naim Alkhouri from Arizona Liver Health. I'm the director of the Fatty Liver Program and the chief of transplant hepatology at Arizona Liver Health. Over the next few minutes, I would like to tell you about current and exciting upcoming treatments for non-alcoholic fatty liver disease or NAFLD. So these are the objectives for this talk. First, I'm going to describe the current medications that can be used in patients with non-alcoholic fatty liver disease. And then I'm going to discuss some future pharmacologic agents that are currently in clinical trials and may get FDA approval in the next few years, potentially one this year. And then I would like to provide a futuristic look on how the management of fatty liver disease would look like in the next 5 years. Of course, lifestyle changes are a very important aspect of the management of fatty liver disease and will be discussed in a separate section. So when we say non-alcoholic fatty liver disease or NAFLD, it's very important to understand that there is a spectrum of diseases that fall under this term, including what we call non-alcoholic fatty liver. Sometimes we call it simple fatty liver. This means that there is only fat within the liver cells, but there is no inflammation or what we call hepatitis. There is no injury to the cells. They just have fat within them. And typically there is no scarring of the liver, what we call liver fibrosis. What we worry about more is what we call NASH, non-alcoholic steatohepatitis. This is when you see, in addition to fat, inflammation, injury to the liver cells, and it becomes really a significant disease when you start building up this fibrosis scar tissue. And this is something that we give different stages. So stage 1 is very mild fibrosis, and then stage 4 is basically cirrhosis. And most of these treatments that we will discuss, they target patients with NASH, again, inflammation, liver cell injury, and a significant degree of fibrosis or stage 2 or 3, because fatty liver disease is very common. Treating everyone with fatty liver will be a little bit challenging because of the numbers. We have probably close to 80 million people with fatty liver. And then targeting patients with cirrhosis, that might be too late. So we have that window, patients with NASH and stage 2, 3 fibrosis that we can target. And with the new medications, we can target the fat, what we call steatosis, we can target the inflammation, we can target the liver cell injury, and we can target also the scarring of the liver. So very exciting times to treat fatty liver disease. And why do we care about these patients with stage 2 and 3 fibrosis and higher? Because we have several studies that show that when you look at who develops liver complications like fluid accumulation, confusion from liver disease, needing liver transplant, and it seems like in all these studies, it's when you get to that stage 2, 3 fibrosis when you start seeing an increase. And then when you get to cirrhosis, the risk goes up exponentially. And we see this in several studies. So how do we manage fatty liver disease? Number one is weight loss through lifestyle changes, exercise, eating a healthy diet. And we do have goals. And my goal for my patients is typically to lose 10% of their actual body weight. So if someone weighs 250 pounds, my goal is 10% of that, so 25-pound weight loss. Because we have studies showing that this can affect actually fibrosis, which is the scarring. It can also decrease the inflammation and the liver cell injury in the liver. And the key is that any weight loss is good weight loss, but if I have to give my patient a target, I would aim for 10% of their body weight. And weight loss can be done through lifestyle changes, but also we have some medications that may help with weight loss, and bariatric surgery, weight loss surgery is also another option for selected patients. But we have issues with weight loss in our country. Most people are not able to lose weight, and then if they lose weight, they tend to regain the weight. And here I'm showing you in this slide some of the food challenges that we have in the United States, including a very large pizza and a very big donut. And, because of our lifestyle, which tends to be more sedentary, and we tend to eat these large meals, most people are not able to lose weight with lifestyle interventions. So that's why we need medications for certain patients. So what are the medications that are available to us today that we may consider using in selected patients with fatty liver disease? Again, the ones that have this NASH, non-alcoholic steatohepatitis, and some degree of scarring of the liver. One trial looked at using two available medications, but they're not FDA approved for NASH. The first medication is called pioglitazone. This is a diabetes medication, and this is again FDA approved to treat diabetes, but not fatty liver disease. But we selected to use this one in the trial because it improves the sensitivity to insulin and it may help decrease the amount of fat and inflammation in the liver. The second medication is vitamin E. Vitamin E is an antioxidant and it may help decrease inflammation in the liver. And then we always give placebo to our patients to really see the effect of the drug. So in this trial called the PIVENS trial, we randomized 247 patients without diabetes, but they all had NASH, the aggressive form of fatty liver disease, to receive pioglitazone or vitamin E or placebo. And we wanted to see the changes on what we call liver biopsy, which is when you stick a needle in the liver and take a piece of tissue and then look under the microscope. And when we looked at a resolution of NASH, it seems like there was a resolution with pioglitazone, and also it seems like there was a trend with vitamin E. So compared to placebo, they both, it seems like, to improve NASH and lead to decrease in inflammation and liver cell injury. But people think, oh, well, if it's a vitamin like vitamin E, we might as well take it. But vitamin E has been associated with potential for side effects. So it's important to understand these, including potentially increased risk of prostate cancer in men and increased risk of hemorrhagic stroke, despite the fact that vitamin E has many other beneficial effects. Pioglitazone can cause weight gain in patients. So this is a known side effect that can lead to fluid retention and worsening of heart failure, and potentially there's increased risk of bladder cancer and osteoporosis. I always tell my patients that any medication, including aspirin and Tylenol, can have side effects. So there is no magic pill that has no potential to cause harm. So again, vitamin E, pioglitazone, it seems like they have some efficacy, but they do have potential for side effects. So they need to be prescribed by a specialist who can monitor for the development of side effects and assess efficacy, because they're not 100% effective. Another trial looked at another diabetes medication called Liraglutide, and this is an injectable drug that we have, again, approved for diabetes, not for fatty liver disease, but this improves sensitivity to insulin. It improves blood sugar in patients with diabetes. So patients were randomized to receive this medicine, Liraglutide, or to receive placebo, and it seems like in terms of resolution of NASH, the aggressive form of fatty liver disease, Liraglutide was more effective than placebo. And one great thing about this medicine, it actually makes you lose weight. And that was evident in the trial that patients on liraglutide lost more weight than placebo. And then there was improvement in liver enzymes, something we call ALT. So this is a blood test and it decreased more if you use liraglutide. So promising results, but this was a small trial. So this is not approved yet in patients with fatty liver disease. We have a society called ASLD. This is the American Association for the Study of Liver Disease. They have guidelines on how to treat fatty liver disease. And basically, they recommend two medications. Pioglitazone may be used in patients, especially with diabetes or pre-diabetes. And then vitamin E in patients without diabetes could be considered. Liraglutide, because of the small study, is not recommended yet. Metformin is another diabetes medication that we use commonly. It doesn't help improve NASH, but it's a good diabetes medication. So it could be added, but it cannot be used to treat fatty liver disease by itself. So these are the current medications that we can consider today: vitamin E and pioglitazone, and then maybe if someone has diabetes and it's not under good control, consider medications similar to liraglutide. There are several other medications. We call them GLP-1 agonists. But what are the future treatments that we are working on now and we have currently in clinical trials? And these trials are available to our patients in Phoenix and also throughout the country. We have several therapeutic targets that we can use to treat this disease. And this is a complicated slide meant for medical professionals, but I can simplify it. So we have medications that target your metabolism, improve the way you metabolize fat and how we utilize insulin. And these are potentially effective medications to decrease the amount of fat in the liver. We have medications that target the gut microbiome or the gut bacteria, and they also target what we call bile acid circulation. These are things made in the liver that help us digest fat, but they have other roles in the body. We have medications that protect the liver cells from dying, and these can be potentially effective for fatty liver disease. We have anti-inflammatory drugs to decrease liver inflammation, and then we have anti-fibrotic drugs to decrease the scarring in the liver. So these are the main mechanisms that we are targeting to find new treatments. And we actually have a race to find effective FDA-approved medications to treat patients with NASH and liver fibrosis. And today we have 4 medications in what we call phase 3 clinical trials. So this is the phase that, if you're successful, typically will lead to FDA approval. So we have medications that target your metabolism, and I'm going to mention 2 of them. The first one is called Erasmutarome, and the trial is called the Maestro trial, and this is ongoing. The other one is called Aeron Cole and the Armor trial. So these 2 target your metabolism and how you utilize fat. We have a medicine called obeticholic acid that actually completed the first phase of the phase 3 clinical trial and showed good efficacy in terms of decreasing the scarring in the liver. And that could be potentially the first FDA-approved medication to treat patients with NASH and significant liver fibrosis. We also have a medicine called Cinevaroc, and this works on decreasing the inflammatory cells in the liver, but also it decreases the scarring in the liver. So all of these medications, if successful in the phase 3 trial, could potentially become FDA approved. So let me tell you about these medications briefly. So Erasmutarome is a medicine that works on the thyroid hormone receptor. So we all have this thyroid gland that makes the thyroid hormones, and they play a very significant role in our metabolism, and they accelerate our metabolism. So this drug mimics the thyroid hormone. It works on the receptor, and you get all the positive effects from the thyroid hormone, like decrease your cholesterol and potentially decrease the amount of liver fat, and it avoids some of the toxicity that comes with thyroid hormone, such as increase in heart rate and bone loss. So potentially a very good medication, not just for the liver, but also for your overall metabolism. And this is a study that looked at the efficacy of this drug and the amount of fat reduction that we get with this medication based on MRI imaging. And I just want to show you that, after only 3 months of treatment, there was significant reduction in liver fat. And then if you look at patients that had NASH resolution, so this means that they had decrease in inflammation and no evidence of liver cell injury, that a significant number of patients on the drug compared to placebo had response. So this is a promising drug, but we need more data before FDA approval. The other metabolic drug we have in phase 3 is called Aeron Cole. This is a combination of what we call a fatty acid and bile acid, and it works on our metabolism. It inhibits an enzyme called ASAD that actually makes you produce more fats in the liver. So we have some preliminary studies showing some efficacy. And this is from a trial called the ARREST trial. So when you look at the amount of fat reduction with this drug compared to placebo, there was significant reduction in liver fat here compared to the placebo. And there was also significant resolution in NASH compared to placebo. So another promising drug. Now we have drugs that target the gut bacteria and bile acid metabolism. And the most advanced drug we have is called obeticholic acid. Sometimes we call it OCA for simplicity, or OCA. And we have a very large study called the Regenerate study that is targeting enrolling 2,400 patients. But actually, we had the first phase of the trial that included, roughly speaking, 1,200 patients. They did a biopsy at the beginning of the trial, biopsy after a year and a half of treatment. And actually, this drug showed some good efficacy in terms of improving scarring in the liver. So I'm going to point to the scarring right here. So this is the effective dose of the drug. This is placebo. And there was significant improvement if you take this OCA medication to decrease the scarring in the liver, which is very important for our patients. And this is how you can prevent them from progressing to cirrhosis. And this medication is under review with the FDA now for potential approval. This medication has some side effects, including pruritus, which means itching, and it may also increase your bad cholesterol, what we call LDL cholesterol. And there was potentially a signal that patients develop more cholecystitis, which means basically inflammation of the gallbladder. So typically this is when patients have gallstones and they end up with gallbladder inflammation. We have medications that target inflammation or fibrosis directly. And the medication I'd like to mention, which is in phase 3 trials, is called Cinevaroc. This actually decreases the recruitment of white blood cells into the liver, and white blood cells are the ones that cause inflammation. And we also have some promising preliminary data on this drug compared to placebo in terms of improvement in fibrosis. In one trial, there was a reduction in liver fibrosis by one stage in 20% with the drug compared to only 10% with the placebo. This was after 1 year of treatment. So again, promising results, but we need more information from a larger trial. So this is a quick summary of, some of the medications that we have, and we have many more. And as I mentioned, these are available in clinical trials, which could be an option. So how are we going to manage our patients in the future? This is a patient with fatty liver disease. He's 60-year-old with diabetes and high body mass index indicating obesity, and he has potentially metabolic syndrome, which means there's also increase in his triglycerides in the blood, and his cholesterol is not the best. And he comes to us because of elevated liver enzymes, what we call ALT and AST. This is a patient that we can quickly determine if he has significant disease with a test called FibroScan that measures the stiffness of the liver and tells you if he has significant fibrosis. And, when we did the test, it seems like he has significant fibrosis or advanced fibrosis. So again, his liver is scarred. And this is a patient that we can consider for treatment with the new medications if FDA approved, such as OCA, Cinevaroc, Erasmutarome. So we're hoping that in the future, we will not need to do liver biopsies to decide on starting treatment, and that we can have actually medications that can potentially reverse this advanced disease and take it to a less advanced disease. So to close, there are medications that can be used today, such as vitamin E and pioglitazone or liraglutide, potentially in patients with NASH. We should, identify these patients, determine the severity of their disease, and if they have advanced disease, then send them to a specialist to consider treatment. We also have several clinical trials evaluating different new medications that target different aspects of the disease, and we may have the first FDA approval by the end of this year. And it seems like patients with type 2 diabetes and obesity, these are the high-risk groups for NAFLD and NASH. So we should really screen all of these patients in our clinics. And then once we find evidence of fatty liver disease, determine if they have advanced disease and consider them for pharmacologic treatment. Thank you for your attention.